Objectives. At the end of this video, viewers will be informed about healthy sleep habits. Viewers will be able to identify risk factors for insignificant sleep schedules and how to improve their sleeping schedule.
Healthy People 2020's goal is to increase public knowledge of how adequate sleep and treatment of sleep disorders improve health, productivity, wellness, quality of life, and safety on roads and in the workplace. 25% of adults in the United States report insufficient sleep for at least 15 out of 30 days, according to Healthy People 2020. Sleep is a critical determinant of health and well-being, according to Healthy People 2020. A third of U.S. adults report that they usually get less than the recommended amount of sleep, according to the CDC.
According to Fundamentals in Nursing, there are different types of sleep disorders. The first type is dysomnias. These are disorders related to falling asleep, staying asleep, or sleeping for too long. That is, they're related to the sleep cycle. Examples of these include insomnia, sleep apnea, jet lag, or narcolepsy. The second type is parasomnia, and this is disorders relating to abnormal sleep behaviors, which include sleepwalking, sleep terrors or sleep paralysis, or bedwetting. And the last type of sleep disorders aren't as common, but they're secondary sleep disorders. And these are disabling symptoms of underlying disorders. They can occur due to psychological or physiological reasons, such as COPD for a physiological reason, and anxiety is a big psychological reason why people don't get a lot of sleep.
Sleep is needed for the ability to fight off infection, support metabolism of sugar, work effectively and safely, and perform well in school and work. If you only get inadequate sleep, you could be at risk for heart disease, high blood pressure, obesity, or diabetes.
There are different factors affecting sleep. And these include your lifestyle, your diet and your exercise, smoking, alcohol or drugs, any medications, positive or negative, environmental factors, illnesses and hospitalization, or anxiety and stress. All these, whether they're alone or added up together, can affect how much sleep you get every night. There are different ways to improve sleep. You can be consistent. You can set a schedule on when you want to go to sleep and wake up every day, and that helps your body get used to waking up on your own, so you might not need as many alarms after you start sleeping normally for a while. You can sleep in a quiet, dark room with comfortable temperature. It shuts off distractions and it helps you focus on sleeping. Keeping electronics out of your room is a big way to improve your sleep. A lot of people forget that blue light and screens is very harmful to our brains right before sleep. Avoiding large meals, caffeine, and alcohol before bed. This helps our body slow down for bed. And lastly, getting exercise throughout the day is a great way to promote a healthy body, which in turn leads to healthy sleep.
Hi, my name is Savannah and I'm going to be your nurse today. May I have your name and date of birth?
Jill Cooney, June 21st, 2001.
And what brings you in today, Jill?
I'm just here for a checkup.
Here for a checkup?
Yeah.
So I noticed at your last visit, we talked a little bit about sleep, but you had to go. So we didn't get a lot of time to talk about it. So I feel like that should be our main focus today. Is that okay?
Yeah, definitely.
How have you been sleeping?
All right. I think it could be better.
Okay. When you mean by better, or when you say better, what exactly do you mean?
Sometimes I have a hard time falling asleep. Usually I'm on my phone a little bit before I go to sleep. I don't know. I feel like once I'm asleep, my sleep's pretty good, but yeah.
Perfect. Do you have any bedtime routines?
Not really. I try to go to bed by 10, but that's probably my only routine.
Okay. What time do you wake up?
It varies a lot on the weekends and weekdays.
Do you take naps during the day?
Sometimes.
For how long?
Probably an hour max.
Do you drink beverages with caffeine such as colas, coffee, or tea?
Usually I'll drink coffee each day.
How many cups of coffee?
I'd say 2 to 3.
2 to 3. And what do you do
Usually I just wait it out. I don't really have any, things I try doing if I can't sleep.
Okay, no over-the-counter medications, prescription medications, or herbs?
No.
Why do you think you're having sleep problems?
I don't know, I maybe need to work on my schedule, but, sometimes I just feel like I don't have enough time for sleep.
Okay. Are we stressed?
Yeah.
Stressed.
Mm-hmm.
Is that from your occupation?
Probably being a student.
A student? What
Yeah.
kind of student? What kind of student?
I'm a nursing student.
Oh, great profession. Has there been any recent changes at home and you started new medications?
No.
How long do you think it takes for you to fall asleep?
Probably about a half hour or more.
Half hour or more. And you haven't tried anything to improve your sleep?
No.
Okay. Are you willing to try new things to improve your sleep?
Definitely, yes.
Do you feel like when you wake up, you get headaches? Have you felt any headaches before, or just nausea?
Sometimes maybe when I lack a lot of sleep, I'll start to get headaches.
Okay. Do you have any vivid dreams?
Sometimes.
Have you been told by either family, spouses, or friends that you sleepwalk or talk in your sleep?
No.
Alright. To begin, I would like to talk about bedtime routine. I think it really benefit you if we had a consistent schedule of going to bed and then getting up at the same time. Limiting your screen time 30 minutes before bed, no blue lights, no TV. Make sure your room's dark, a nice comfortable temperature. Furthermore, our naps should take only 30 minutes. We don't want to sleep more than that. Because then when we get so much sleep, then we won't sleep that night. For your caffeine consumption, I would try to limit you to maybe 1 cup of coffee a day, or be cautious and mindful of when you drink your cups of coffee. And then for remedies, try meditation. See if maybe, I know that there's a lot of stressors in nursing school. Taking time for yourself, reading, exercise is very good for you, for both mentally, mentally and physically. And then furthermore, I would go ahead and see how those work for you. And then if there's anything, this just is not working, come back and see your primary care provider. Come back and see us, okay?
Okay,
Is there
great,
any other
thank you.
questions? Of
I
course.
don't think so.
Okay, thank you so much.
Thank you.
In conclusion, it is equally important to ensure a healthy sleep schedule as it is for a healthy diet. Sleeping heals the mind, body, and soul. Sleep disorders are either a change in the normal sleep cycle, such as dysomnias, or abnormal sleep behaviors, such as parasomnias. Continually getting inadequate sleep can put someone at risk for heart disease, high blood pressure, obesity, and diabetes. To improve sleep, you can have a consistent schedule, by keeping your electronics out of the room, by avoiding large meals, caffeine, and alcohol before bed, and lastly, by getting an adequate amount of exercise throughout the day.